Excellencies, distinguished delegates of the Member States, Director General of the World Health Organization, regional directors, ladies and gentlemen. First and foremost, let me congratulate the 73rd President of the World Health Assembly, Ms. Keva Vance from Bahamas, for successfully conducting the proceedings during the 73rd World Health Assembly last year. It is a great honor and a privilege for me to address the 74th World Health Assembly as its president. I convey my humble and deepest gratitude to the member states for bestowing upon Bhutan the honor and the confidence of the presidency of the highest and the most important global forum on health, the World Health Assembly. On behalf of His Majesty the King, the Royal Government of Bhutan, and the people, I convey to you the best wishes and offer my sincere prayers for the successful conduct of this prestigious event. Excellencies, distinguished delegates, since the establishment of World Health Organization in 1948 with the mandate to address the global health concern, never has the world realized the vital role that this organization plays in safeguarding the health and well-being of the global citizen as we do now. I express my deepest appreciation to the founding members and the current leadership of the World Health Organization across all its regional and country offices. Amidst competing ideas, resistance, inhibition, and uncertainty, the team at the WHO, under the able leadership of the Director General, has been committed in steering our world through this unprecedented crisis. Excellencies, distinguished delegates, the last 1.5 years has touched the very core of humanity. Never have we, as a global citizen, experienced such adversity cutting across every aspect of human existence. The virus today has infected hundreds of millions of people worldwide, resulting in more than 3 million deaths so far. For all those who have lost their loved ones to the pandemic, I offer my sincere prayers and deepest sympathies. And for all the frontline workers who continue to work tirelessly to contain the pandemic, I offer my heartfelt gratitude for your commitment and unwavering dedication. The WHO this year is historic and imperative for the way forward. It is through the united presence that we can put our hearts and ideas together and draw strength to overcome the adversity. Though virtual, all the nations have come together in the spirit and solidarity to share their stories, struggles, and hear each other to seek guidance and solutions collectively. Excellencies, distinguished delegates, ladies and gentlemen, Bhutan so far has been fortunate largely due to the selfless leadership of His Majesty the King, who forged a unified all of the government and all of the society response to the pandemic, a response that is guided on the core principle of empathy and compassion, while ensuring all our policies and actions are based on best scientific evidence available at the time. For my small country, the singular moral authority of the sovereign, with its ability to unite the nation, augmented by the technocrat cabinets with a strong public and medical background, was instrumental in averting a major public health crisis. While our response were aligned to the cultural ethos of our people, we thank the WHO and the global scientific community for timely and continuous generation of scientific evidence to guide the course of action in our country. This helped us ensure that our policies and strategies were always based on sound scientific evidence. Excellencies, distinguished delegates, ladies and gentlemen, today as we look back, beside the unimaginable number of positive cases and premature death across all ages and countries, The pandemic has also grossly magnified the inequalities in accessibility and availability of health and social services across the world. It is clear that the disparity in accessing diagnostic and therapeutic services were widened along the traditional fault line of socioeconomic status of a nation. For example, the ability of a low and a middle-income country to effectively contain and prevent premature mortality from the pandemic has been limited by their access to diagnostic and therapeutic services, which is further exacerbated by existing weaknesses in health human resource, health infrastructure, health technology, health financing, and a strong governance. Today, no one can escape from the grimness of the daily news. Where we stand is hard to predict. Thus, in this era of uncertainty, I truly feel that selfless leadership is the lifeline in containing the pandemic. Leadership may be hard to define, and it is even harder to find during the crisis. However, it is impartial to say that only selfless and compassionate leadership will stir the ship forward in the ocean of turmoil. Excellencies, ladies and gentlemen, the current pandemic has once again reminded us that when it comes to critical and common global threat, the world is undeniably a singular unit, and we must come together as one to devise common solution for problems that can affect all of us. Director General, your timeless quote, "No one is safe unless everyone is safe," will, over the generation, inspire future public health professionals and define a framework for global public health management. It has also taught us that it is only through the power of solidarity and cohesiveness that we can work to respond to the global pandemic in the future. As the pandemic continues to spread in different pockets across the world with the looming threat of different variants of the virus, we must now think of a global recourse, a recourse that is deeply rooted in the value of humanity and compassion, that must arise above petty nationalism and reach out to each and every individual on this planet. We must continue to emulate and build forward on the good practices we have seen across the world in the fight against this pandemic and build a better future. One such remarkable achievement is the pace at which the COVID vaccines were developed and rolled out for emergency use. Excellencies, ladies and gentlemen, as we forge ahead, it is critical to consider three systemic changes to engender more favorable public health outcomes during pandemic and other public health emergencies of global concern. Firstly, to ensure resilience and enhance preparedness during future public health emergencies, as I have advocated in various global and regional health forums in the recent past, I once again would like to call upon the member state to consider a global humanitarian corridor to ensure a seamless flow of medicine, vaccines, and other critical health commodities during the pandemic and public health emergencies. I strongly feel that such display of true solidarity would have a profound impact on the public health and the lives of countless people all over the world, especially those living in harsher socioeconomic environment. Secondly, during pandemic and global health emergencies, it is often the most vulnerable in our society who are affected to the greatest degree: women, children, differently abled, and those with chronic diseases. Thus, while designing and instituting our preparedness and the response system, We must relook at the current system and strategies to address their specific and special need, both during normal times and during public health emergencies. Today, as we discuss the urgency to manage the pandemic, we must not forget our routine health services. I would like to bring to the attention of the member state that equal number of people are dying of preventable cancers. It was during the last executive board meeting that Bhutan tabled the agenda on elimination of cervical cancer, a cause that I have been truly and extremely passionate about. There is a greater need for a concerted investment to address these chronic issues, which, if left unattended, will consume the world. Excellencies, ladies and gentlemen, finally, it is clear from scientific evidence that the pandemic can only be controlled when everyone is vaccinated. It means that the equitable access to vaccine and comprehensive global vaccine drive is the only way forward to contain this pandemic. It is time now for the global community to come together as one to ensure that every country in the world gets sufficient doses of the COVID-19 vaccine to vaccinate every eligible citizen. We must remember that only solidarity and science, and not solitude, will get us out of this pandemic. Excellencies and esteemed delegates, unless we walk the talk, we will not be able to move forward. These are extraordinary times that calls for extraordinary interventions, and humanity and its well-being must at all times prevail over mere economic benefits. Once again, I wish the World Health Assembly a very successful deliberation, and I thank the World Health Organization under the exceptional leadership of the Director General for enabling us to come together for the 74th World Health Assembly. Together, we must strive to make health the heartbeat of developmental agendas. Thank you, and Tashitele.